Hey guys, Dr. Rodman with Sports Chiropractic, and we work on a lot of injuries here, a lot of problems from head to toe, but probably the most common area that we see or treat, the most often complaint, is really that tightness, like right in the shoulder blade in this trap area. So previously we've talked about things you can do to help that, such as like using the stick, this hook here to get on there, or using the PVC pipe to kind of roll it out. But I've recently found a really good way to kind of get in there with a lacrosse ball, which we haven't really used before. And what you want to do is take a lacrosse ball and basically put it right into that upper trap area, right through here where that spot is. And you're just going to kind of bend over and place it on the wall. And from here, I'm just going to pin that spot down and kind of tilt my head laterally to the side and rotate it. And I'm trying to kind of create some movement while I have that muscle pinned down. So this is a great way to get that tension out of that upper shoulder, a very common area. But there are some people that you actually don't want to do this on. So if you take a look in the mirror at your shoulders, if your shoulders actually kind of sit down like this and have that big stretched out position, as you can see on Bones here, if you imagine that his scapula was kind of downward sloping, then this muscle's already stretched a lot, and it'll have that knot in there because it's really trying to stabilize the shoulder. So that really is a problem probably in the lat or something else that's pulling that shoulder down. So if you look in the mirror and you see that that shoulder is really down like this area, you probably want to work around and see if there's some other spots that are actually pulling that shoulder down. But this is a great technique to use for that person that comes in and just has that really high shoulder, very tender point right there in that spot, and that's that type of person you're going to want to work on with the ball. Anybody else, we can always check it out and let you know where the problem's coming from. It's a great technique to try at home. You want to hold pressure on there for about 2 minutes until that muscle releases. If it's ever more than a 7 out of 10 on your pain scale, you want to go ahead and back down a little bit. You're putting a little too much pressure on that spot.